Can you look at these x-rays for me?
One second.
Dr. Tom, I have a 9-year-old. Last 5 months were about a year ago, so you might get some new ones.
Okay, go.
Dr. Tom, I need to start getting that.
Alright, go.
The fuck, you please sign this paper for me?
And accept my regimen. Ready to go? Okay, why don't you taste that one? Alright.
Do you think that needs a crown?
Definitely a crown.
You forgot.
Listen, there's 12 babies outside, and if you keep screaming, they're gonna start crying. You wanna deal with them? So shh. You wanna deal with them? So shh. Today we're gonna talk about the principles of pharmacology and oral conscious sedation. So absorption is the process by which a drug leaves the site of elimination to enter the circulatory system. It's a drug that is distributed in the body. It comes into contact with numerous membranes. Small ionized lipid-soluble drugs permeate plasma membranes most easily. Patient-associated factors that influence drug absorption, dependence, and route of administration. Distribution depends on organ perfusion, protein binding, and lipid solubility. Reabsorption is responsible for the termination of its effects, and many anesthetic drugs not eliminated. So some of the organs that are perfused is heart, lung, brain, liver, kidney, cartilage, blood vessel, muscle, fat, bone. Adverse reaction: no. Syringes, disadvantages: poor patient compliance, prolonged duration of action. Oral route GI absorption is dependent on lipid solubility.
Alright, sweetie, I'm gonna roll you back. Okay.
Jenny, what are you doing today?
We're gonna do an SSC on tooth number B.
Okay. You have 5 minutes. Ready?
Okay.
Go.
We're gonna start the nitrous.
Jenny, almost done? Jenny, almost done? Jenny, almost done? Your
no.
next patient's here. I'll put it right here for you, okay?
Okay.
Thank you, Dr. Tom, for all your hard work this past year. We've learned so much from you, and you've been so patient and supportive in our clinical experiences. You truly deserve this honor for all your hard work to USC Pediatrics, and this place would not be the same without you.
Congratulations, Dr. Tom! Hi, Dr. Tom. We just want to say congratulations. You've been an amazing mentor. We're super lucky to have you.
Congratulations, Dr. Tom!
Oh, hello. I have a few things to say about Dr. Tom. And you know him as a wonderful instructor and a perfect mentor and a compassionate human being. But there's some things you don't know about Dr. Tom that I want to share with you. First of all, he is developing a national reputation. Dr. Tom is involved with the American Board of Pediatric Dentistry. He's on the exam committee. He is a consultant to the American Board. And he's involved with the American Academy of Pediatric Dentistry. He is the chairman of the Council of Postdoctoral Education. You know that? Do you know the pediatric dentistry reading list? He's the person that puts that awful thing together. And then the other thing that you finally need to know about Dr. Tom is that he officially now is an associate professor of clinical dentistry. He's just received his promotion. So congratulations, Dr. Tom. The program is in good hands and will continue to be in good hands in the future. Thank you.
Hi, Dr. Tom. Everything he said. Love ya.
Hi, Dr. Tom. Congratulations on being honored at Alumni Day. It is well deserved. You are a wonderful teacher. You are very passionate about your work, and you are definitely one of the highlights of the 20 years I was at USC. So cheers to you. This is as close as we get to champagne in the Central Valley, and I just want to say you are a very dear friend to me. I love you dearly. I miss you dearly, and congratulations.
Tom, you have been such an amazing mentor and friend to me for over 15 years now, and it is really difficult to find words that adequately express the appreciation, love, and gratitude that I have for you. I first knew you as my clinic director when I started the USC residency program in 2001, and At that time, you expected nothing but my best, and because of that, I graduated with a solid foundation in clinical pediatric dentistry. Now, 13 years after my graduation, I am still inspired by your never-ending thirst for knowledge and dedication to our profession. Some teachers we appreciate for their brilliant minds which inspire our own minds to go further than we imagined possible. Other teachers we have gratitude for because of their empathy for us as students, an empathy that allows them to teach to their students' understanding, to our comprehension, and to our compassion. But few teachers have both. And Dr. Tom, you are one of those rare individuals who has both these things effortlessly, or you seem to have it anyways. And for that reason, like no other teacher I know, you have made infinite amounts of information and just never-ending inspiration stick with me long after you first became my mentor and later my friend. So, like I said, it is with much appreciation, love, and gratitude that I join the Alumni Association, your peers, and your students in honoring you today. Thank you, Tom.
Hi, Dr. Tom. It's Andrea Pinnett Gamble, and I want to say thank you. It is through your compassion, your knowledge, your skills as a pediatric dentist, and dedication to the USC Pediatric Dentistry program that makes you an exceptional faculty member, and we are so lucky to have you. Not only are you an outstanding pediatric dentist and clinical professor, but you are an amazing mentor and, most importantly, a great friend. I truly feel USC pediatric dentists are the best. This is mainly because of you. You are the one to help lay the foundation to our clinical education as pediatric dentists. You are the one that gives us a skill set and confidence to excel in our careers as pediatric dentists. Even after the program, you continue to always be there for your former residents, simply just a text away. I know I can always count on you about questions on challenging clinical situations and evidence-based dentistry. I want to thank you for all you do. You are the best. Thanks so much, Dr. Tom.
Deborah Student-Pavlovich, Chair of Pediatric Dentistry at the University of Pittsburgh. Congratulations, Dr. Tom, on being honored at today's annual Alumni Day by your faculty, residents, students, and alums. I met you over 20 years ago when I was a visiting faculty member at Case Western providing lectures to the third-year dental class. You were a second-year pedo resident who was appointed to serve as the course coordinator since my colleagues and I were only at your school on Fridays. It was a position that you assumed very conscientiously, and I could see early on through your interactions with us and with the students in the class that the skills you developed would be so well suited for an academic career. I was happy when you telephoned me and said that you were staying on at Case Western and subsequently to USC for a full-time position. You have served our specialty very well in the past 2 decades, working diligently with the American Board of Pediatric Dentistry on the written qualifying exam as well as the oral clinical exam. All organizations you represent, including District 6 representative for the Postdoctoral Council of Education on the American Academy of Pediatric Dentistry, as well as your state and local organizations, are very lucky to have you working for them. Enjoy this well-deserved honor, Dr. Tom, and I wish you continued success in the future.
It's hard to believe that Tom has been at USC for 17 years already. Now, based on the age that he claims, he must have started when he was about 9. Well, anyway, for most of those 17 years, Tom and I have been friends and colleagues, and it's always a pleasure to work with him. We've worked together through the AAPD, through CSPD, And Tom is always so gracious to offer my pre-doctoral students an opportunity for an externship there at USC. A lot of those same students have gone on to become his residents. And every student that comes in contact with Tom has nothing but positive things to say about him, the kind of teacher he is, and the way he manages the program there at USC. Now, the other thing that's important to know about Tom is that when something important goes on and you need to know the dirt, Tom's your guy. In all seriousness, Tom, congratulations on 17 years at USC. And thank you again for all that you've done for students, for the specialty of pediatric dentistry, and for me here at the University of the Pacific. Here's to another great 17 years.
Hey Tom, this is Linda. I just want to congratulate you on receiving the USC Service Award. You're very deserving, and I wish you the best, and have a great time at the reception, and we'll see you in October at the OCE. Actually, it's September. Sorry about that. We'll see you in Dallas. Take care, and so happy for you. Have fun. Bye-bye.
Dear Dr. Tom, it is so nice to have such a devoted and committed faculty member to work with in pedo. I really enjoy collaborating with you and the whole pedo department. I feel that working together closely and having an open line of communication is so important for providing high-quality patient care. And you know I always look forward to coming down to your clinic and being surrounded by the murals and the whole pedo environment. It brings back good memories. Thank you so much for everything that you do.
I got this feeling inside my bones. It goes electric wavy when I turn it on. Off from my city, off from my home. We're flying up no ceiling when we in our zone. I got that sunshine in my pocket, got that good soul in my feet. I feel that hot blood in my body when it drops. Ooh, I can't take my eyes off of it, moving so phenomenally. You're more like the way we rock it, so don't stop. And under the lights when everything goes, nowhere to hide when I'm getting you close. When we move, well, you already know. So just imagine. Nothing I can see but you when you dance, dance, dance. Feel good, good creeping up on you. So just dance, dance, dance. Come on. All those things I shouldn't do, but you dance, dance, dance. And ain't nobody leaving soon, so keep dancing. I can't stop the feeling. So just dance, dance, dance. So just dance, 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 come on. Ooh, it's something magical. It's in the air, it's in my blood, it's rushing on. I don't need no reason, don't need control. I fly so high, no ceiling when I'm in my zone. Cause I got that sunshine in my pocket, got that good soul in my feet. I feel that hot blood in my body when it drops. Ooh, I can't take my eyes off of it, moving so phenomenally. You're more like the way we rock it, so don't stop, stop, stop. Under the lights when everything goes, nowhere to hide when I'm getting you close. When we move, well, you already know. So just imagine. Nothing I can see but you when you dance, dance, dance. Feel good, good creeping up on you. So just dance.